So, welcome back everybody to the second now live session, all about physiotherapy questions from the past week. Thank you very much for following last week. I'm going to upload last week's live video onto my Instagram TV as well, so everyone can watch it live, even though you didn't manage to catch it live. So, I have lots of questions from the last week, so we're probably going to jump straight into the questions as quickly as possible. And there are just a couple of topics I want to cover before we do that. So the first thing that I promised I was going to be talking about, and I really want to talk about, is the role of physiotherapy during the COVID pandemic. A lot of people think that physios only work in rehabilitation of sports injuries and only work in sports injuries, but there's a huge group of physiotherapists who are doing incredible work in the local National Health Service and in the International Health Service. So just a huge shout out to them. It's a great thing to keep in mind is that when people are in intensive care, they're getting both respiratory physio and mobilization. The sooner a patient can move, the sooner a patient can leave the intensive care unit, and the faster they're going to be getting back onto their feet, and the sooner that beds are going to be getting freed up. So it's a massive service to the whole country. So great work to all physios working in that aspect. It's great to keep in mind that physiotherapy can also work online. So when we're jumping back to sports rehabilitation and pain management, physio works online. I've been doing a few online consultations myself. A lot of my colleagues have been doing online consultations, and the feedback has been great. So it's not like the service of general physiotherapy has stopped. There's lots of general physiotherapy going on as well, and I really think that a great job can be done online. At the end of the day, the biggest part of physiotherapy is giving general advice, giving exercise prescription, and giving a graded approach towards exercise. So I really think that the majority of what you're going to get from your physio session can still be imparted with an online session. So that's just something I wanted to say before we start. A big thank you to the National Service physiotherapists, and to just cover a little bit that online physiotherapy really does work and is really going well. So I'm going to jump straight into a couple of the questions that we had from this week. As you to that, there were other questions about other topics as well. So one of the really good questions I got, and the reason I say it's really good is because clients ask me about this all the time in clinic, which is about cracking joints. So people are concerned regarding hearing cracks and pops in their shoulders and in their knees and in their ankles when they're moving around day to day. So there was actually a great study about this, and there's also been quite a bit of research going into it, that cracking joints, as long as it is a pain-free crack and it's not secondary to some sort of trauma. So when I say trauma, I mean stuff like falls or an accident or these kind of things. So as long as the cracking is not started from something, it has what we call an insidious onset, it's nothing to worry about. I can understand it can be annoying if you're trying to sneak in somewhere. You're obviously going to get hurt because of your cracking joints, but otherwise it's no big deal whatsoever. I really wouldn't suggest that you worry about it, and in my opinion, I don't think you should be looking for professional help just because of a cracking joint. Okay, so please don't worry about it. There are numerous reasons why joints joints crack, and the majority of them are not problematic. So please don't worry excessively about it. I don't think that it's something too serious. Okay. So, someone else asked me about them getting some knee pain during squats. Again, without having assessed the person, I can only give a generalized answer, but I would look into two things. First of all, a lot of people are increasing their volume of squats, so whereas normally they would use weight and do 4 rounds of 8 repetitions, a lot of people are shifting now to body weight squats and doing much greater volume. So working on 4 sets of 50, 5 sets of 50, working till fatigue. So that's the first thing you need to look at. If you've increased your volume dramatically, it could cause pain in any joint. So what I would recommend is slowly building up towards the volume you want to get to. So don't jump straight into doing 200 repetitions of squats, because it is going to cause a problem. The second issue I see with a lot of people when squatting is that a lot of people tend to squat and compensate. So what I mean is I see a lot of people squat and drop their knees really far forwards. You're not going to cause damage just because you've dropped your knees forwards, but you do need to keep in mind that when your knees drop forwards, you're increasing the loading on your knees. So what you might want to practice to get better at that is just have a chair behind you, okay? And practice the movement of sitting down onto the chair and coming back up. And that cue just teaches you to hinge more from the hips rather than from the knees. After you've done a few of those, you'll learn how to squat without dropping your knees too anteriorly, and that just tends to be a little bit more friendly on your knee joint. Now, I'm not saying one type of squat is good, the other type of squat is bad, not at all. What I'm saying is, if you're getting knee pain, one thing you want to look at is shifting weight away from your knees and hinging to other joints such as the hip. So one way to do that is by going for a sit to stand type of squat rather than dropping your knees forwards, okay? It could be that the squat is not the ideal exercise for you, in which you might want to look at other variations of knee flexion movements, such as back lunges, such as split squats. Again, there are multiple ways. There's a huge toolbox of movements that you can pick from, so pick the one that's best for you. But in most cases, just changing the hinge pattern in your squat is going to make a big difference. So that would be my answer for that. Another great little question, well, this one actually I got from quite a few people. So it seems like lots and lots of people are getting low back pain. Some people are even getting radiating, so what a lot of people know as sciatic pain, going down the leg from having changed the way they sit or having changed the position that they're in. So we did cover this briefly last week during the live session, and I have given quite a bit of advice already via the videos from last week's set of three videos. So I'm just going to cover some of the main points again, okay? You need to be moving, okay? There isn't any ideal position which you can sit in all day and you're not going to feel discomfort. So no matter how good your posture is, if you're in the same position for too long, you're going to get trouble. Now, that being said, if you're sitting in a deep sofa, which is pulling your chest really close to your knees, or if you're sitting on a chair which is too low or a chair which is too high, and putting yourself into what we call more flexion, your back is going to get tired faster, okay? So do be smart with your ergonomics. Again, there isn't a perfect position where you're not going to feel any discomfort throughout the day, but do try to pick a seating position which is better for you. As much as possible, try to have feet rested on the floor, back nice and straight, elbows rested whilst you work, okay? Again, you are going to need to move out of that position. If you're spending a lot of time in sitting, please, it's so simple. Get up and work a little bit into extension, do the opposite movement. I love the concept of movement snacks. So it's not about doing a half-hour bout of exercise. You snack throughout the day. You have little snacks of food throughout the day. So do the same with movement. Go for a little movement snack every 15, 20, 30 minutes. It's literally going to take 15 seconds and will save you an age of grief at the end of the day. Okay, so please do keep that in mind. Another concept to keep in mind is that, so a lot of people have discussed before discs in the back. So the disc is a structure which is in between one vertebra and the other in our spine, okay? And a lot of people are very scared of this disc. I'm not going to go into that. The back is super resilient, it's super strong. Don't be afraid of your backs, it's much stronger than we'll give it credit for. But the disc does naturally creep through the day. What do I mean? So this structure will move slightly through the day. So when we wake up in the morning, there's a certain amount of space between the discs, between the vertebrae. As the day progresses, that disc space will reduce slightly. Now, the way it shifts, because it's a moving structure, the way it shifts depends on the position we're in throughout the day. So if you spend the vast majority of your day in a shifted forwards position, that disc shift is going to be more towards one position and can potentially cause more problems towards that position. So you want to be doing the opposite movement at the end of the day to help yourself get out of that position a little bit, okay? So it's natural that you're going to get that little bit of shift and a little bit of movement. Okay, so someone asked me if I would prefer to do a full body mobility routine or stick more to one area at a time. So if I'm kind of programming a schedule for my clients, would I prefer giving a full body mobility routine or stick to one area at a time during that specific period of time? So the way I like to work is I like to have a specific mobility. Okay, so I'm just going to take a couple of questions from people that were asking. So Someone asked me about improving their hip mobility. Again, hip mobility is very much linked to the lower back and depending on what's going on in the hip flexors. So what I would definitely go for is routines which open up the hip flexors. So multiple things, but definitely stuff like, and this is covered in one of the lower back movements, where you're over there, bum pushed forwards, holding open over there, arms in front, and rotating away from that side. There's lots of great little banded exercises to do for the hip, but what would definitely be a good idea is that we can do a full video because there's lots and lots to cover, specifically on improving hip mobility and lower back mobility we have already, so that's really, really good. Now, something else lots of people have been asking me about have been questions about how to maintain strength goals and maintain strength during this period of time. So what I definitely will do is have a full video regarding maintaining strength, and that will be the next video I upload probably on Monday or Tuesday next week. So let's just have a look at any other. Okay, so apparently the video paused, so I'm just going to show you the cat camel position again. So cat camel for the lower back is just this. So you're going to have lower back dropping, lower back opening. And that was just one of the 3 lower back exercises we discussed for opening up the lower back. Okay, so that more or less covers the questions from this session, from this live session. So what I'm going to be asking you all for is to please subscribe to the YouTube channel if possible. You'll keep updated with all the content I've been uploading, and if anyone's looking for one-to-one attention or anything such as online consultations, please feel free to drop a live message and I'll happily get in touch with you myself. Until next week, thank you very, very much for the attention.